When we talk about changing roles, we talk about how the profession is evolving in Europe and how, for instance, hospital pharmacists are now more engaged in the wards, as you can see from the European statements of hospital pharmacy. So we're talking about how the hospital pharmacists are, let's say, getting out there, getting out of the basement, if you mind, and like being more involved in the hospital setting and being a key part of the MDTs in the hospitals and working alongside doctors and nurses towards, let's say, at the end, having the common goal that we all have, which is improving patient outcomes. First of all, I talk a bit about a new project that we have, which is the special interest groups. These are interest groups that looked at different aspects of pharmaceutical care. And it's interesting because these groups are composed not only by hospital pharmacists, but also by doctors, nurses, or even engineers. And there are different topics. You can have a look at them on our website. For instance, we have one that works on identifying the benefits of automation within the hospital, and another one that looks at how hospital pharmacists could work on reducing errors in the UCIs. And other aspects that I explained today is a new project that we have, which is the Oath to Society. So it's a commitment that from EAHP we do as part of the hospital pharmacy profession to both explain how committed we are to improve patient outcomes and providing compassionate care, and also to showcase what the profession is doing in Europe. And then maybe very quickly, other aspects from the presentation were the new project that we have started to work on environmental sustainability, and also a very interesting project that we have done with a partner, the Uni of Manchester, that looks at finding a definition for patient acuity from a pharmaceutical perspective, because it doesn't exist. So we're trying to work on that right now. Portugal is one of the countries where the hospital pharmacy specialization is mandatory, one of the only 6 in Europe. It has a very robust hospital pharmacy specialization program. Portuguese hospital pharmacists are very, very well trained. I know that the association is working on trying to do more on clinical pharmacy, for instance. Yeah, but I think that Portugal is at the front of the profession. And as I always say, we try to share knowledge from EAHP, from the European Association, but we also love to get feedback and to learn from our members, and today from the Portuguese Association.